Erectile dysfunction is a health problem that affects millions of men around the world, impacting their emotional health, sexual life, and self-esteem. Today we know that your erectile capacity is not a luxury. It's an accurate indicator of your cardiovascular, metabolic, and even neurological health. Therefore, losing your erectile function is more important than you think, and it's not just about sex. To talk about this, to explain all the latest developments in erectile dysfunction, today we are joined by Dr. Alain Dutra, a urologist who is also a leader in integrative medicine in Brazil and has a strong digital educational presence. In fact, he has a great YouTube channel called Dr. Alain Dutra, and I recommend you subscribe right now because it's very interesting. I'd like to mention that we are at the 5th International Congress of Spanish Society of Anti-Aging and Longevity Medicine, the Spanish Society of Anti-Aging and Longevity Medicine. So if you're a professional and you're interested in staying as up-to-date as possible on longevity, I recommend you become a member of the society. Now let's turn it over to Alain. How are you?
I'm well. It's a great honor and a great pleasure to be with you today.
First, I sincerely thank you because I know you've already given 3 talks today, and here you are for a 4th one. You've been giving talks and speaking about health all day. Today we're going to talk about erectile dysfunction, which is a central topic in urology. I'm going to ask you to explain to the audience exactly what erectile dysfunction is so they can understand.
Erectile dysfunction is about the inability to initiate or maintain an erection. There are people who have difficulty initiating an erection and others who can get an erection but can't maintain it.
And is it a very common health problem?
Very common. Almost 50% of men after the age of 35 experience this situation.
Almost half after 35?
Yes, more and more people and younger are experiencing this situation.
And now we're going to get into the causes, the causal factors, why there is this pandemic, we could say, of erectile dysfunction.
The first factor is that most people are not getting enough physical exercise. There's also a very concerning situation with young people who, in many cases, are having a problem with addiction to pornography.
Oh, pornography is an interesting topic. Want to discuss it? Can it impact erectile dysfunction?
Yes. There is data showing that many young people who have like a preference for pornography, and because of that, people who prefer pornography have a 78% rate of erectile dysfunction with a partner. 78% erectile dysfunction with a partner. Wow.
Also, well, I think the topic of pornography should be addressed separately because I think it's very common, something very trendy and very sensitive, very taboo. But I also understand that when someone has cardiovascular problems like having blocked or calcified arteries, it leads to erectile dysfunction.
In older people or those 40 years or older, it's very common for erectile dysfunction to appear about 5 years before a problem in the coronary arteries. So, when a man has an erection problem, it's very important to keep in mind that it's necessary to do all the required tests to check cardiovascular health. So it's like a very important marker. It's important nowadays for men to please see a doctor if they have erectile dysfunction to check how their cardiovascular health is.
So erectile dysfunction can warn us that we might have a heart attack in the future?
Clearly, definitely.
Very important. After my endocrinology specialty, diabetes makes things much easier.
Right? I think diabetes is the main disease that leads to erectile dysfunction because people with diabetes have a much higher rate of endothelial dysfunction. So, we know that the arteries in the penis are about 2 to 3 millimeters in diameter, and the coronary arteries are bigger, they're larger. So, when a person has erectile dysfunction, it's only a matter of time before they also have problems with their coronary arteries.
And I want to ask you, because you see a lot of men with this problem, about the psychological consequences of having erectile dysfunction.
There is data showing that 25% of men who have erectile dysfunction also have depression or other issues like anxiety, and the opposite also happens. 25 to 26% of men who have depression also end up having erectile dysfunction.
It's interesting because what we see is that in the end, erectile function, when it's good, is a good marker of health because it shows that your cardiovascular system is healthy. Your endocrine system, your mind, your psychology, your motivation. We need to look for good erectile function in men. We can't forget that, right?
Of course, it's very important.
Now let's talk, Alain, about lifestyle. Let's say the non-pharmacological approach, which is something you talk about a lot on your channel, integrative medicine. What habits should a patient who is starting to have erectile dysfunction change?
The first step is to increase physical activity. Nowadays, physical inactivity is the new cigarette, the new tobacco. So, people who work all day on the computer have a much higher risk of having erectile dysfunction. So, physical activity is very important. Also, quitting smoking when people smoke. Another very important thing is to lose weight. People who are obese have a much higher risk of having erectile dysfunction. Occupational risk is also very important. Avoid environmental substances that can be xenoestrogens and other factors, for example, like avoiding high blood glucose. Multiple laboratory tests are very important, such as homocysteine. It's also very important for our people to have good mental health and to get good sleep. People who don't sleep well are at higher risk of having erectile dysfunction.
And going back to what you said earlier about pornography, what happens? Why does it happen that when a person watches a lot of pornography, they have erectile dysfunction?
It's because there's a dopaminergic desensitization in this person's brain. So the stimulus with pornography is very high, very intense, and then when this person is with their partner, the stimulus isn't as strong. And this situation of erectile dysfunction happens.
There's a molecule that's very important for an erection, which is nitric oxide. There's something interesting about it that honestly really surprised me. And it's that the production of nitric oxide also depends on bacteria in the mouth, which reduce nitrates to nitrites, which are then converted into nitric oxide. Is it true that frequently rinsing your mouth with antiseptics reduces that production of nitric oxide?
There are many studies proving that. When a person ages, it's very common for the first nitric oxide pathway, which is through an enzyme called nitric oxide synthase, to not work as well. And in these people, the secondary pathway is more important, which is exactly what you said, that it's very important to have healthy bacteria. These bacteria process nitrates and nitrites, and when they reach the stomach, they are transformed, they are changed into nitric oxide. So, a person who uses mouthwash greatly reduces the production of nitric oxide in the stomach by about 80 to 90%, and that can increase blood pressure by about 5 to 10 millimeters of mercury, and it also increases the risk of reactive dysfunctions.
And what is recommended? Not to use too many mouthwashes or just brush your teeth but not use mouthwashes?
I recommend to my patients not to use regular mouthwashes with chlorhexidine, but instead, for example, to use coconut oil. There is a technique from Ayurvedic medicine, which is like putting coconut oil in your mouth and using it to rinse. To rinse the mouth and reduce the amount of harmful bacteria but not destroy the beneficial bacteria.
Let's talk about supplementation. Which supplements allow us to optimize erectile function or increase nitric oxide production? Okay, ¿cómo se produce esa erección? Which ones actually work with solid scientific evidence?
The supplement with the most solid evidence is Prelox, which is the combination of pycnogenol and L-arginine.
Arginine and pycnogenol?
Yes, arginine with pycnogenol. Citrulline also has good data on its effect, and with a slightly lower level of evidence, there's the use of, for example, Korean red ginseng. So there's another supplement with a slightly lower level of evidence called fenugreek.
Which ones do you use in your clinic with patients, and which do you prefer?
I prefer to use a combination of Telafilo with arginine, citrulline, and also pycnogenol. and I also use nattokinase.
Nattokinase, and what dose of telafilo?
5 milligrams a day.
Daily as a maintenance dose?
Exactly, yes. There is data that shows a 40% decrease in cardiovascular risk just by using telafilo.
So these drugs can also help reduce the risk of heart attack, of course, due to the same mechanism.
It helps reduce the risk of heart attack, lowers blood pressure, and improves endothelial health.
Of course, now everything regarding supplements, let's talk about conventional pharmacology. Let's say the history of pharmacology in erectile dysfunction goes back several decades. These are the major drugs that help their phosphodiesterase type 5 inhibitors, sildenafil first, tadalafil, and I think there are some new ones as well, vardenafil. Okay, how do they work? So the audience understands how these drugs work. What do they do?
These drugs specifically work by decreasing the action of an enzyme. This enzyme is responsible for reducing nitric oxide. So these drugs help maintain the erection for a longer time because they allow nitric oxide to act for a longer period.
What do patients do wrong when they take these drugs?
It's very common in the case of talafilo, it's muscle pain. In the case of sildenafil, which is the older drug, it was more common to have headaches and nasal congestion.
Can talafilo cause muscle pain? Yes. And can it cause drops in blood pressure and dizziness?
It's possible but uncommon.
There are also other treatments that are applied directly to the penis, right? Yes. They make me a little nervous. Intracavernous treatments, right? Yes, it's...
The treatments are older, more traditional, but they still work. They're still indicated for people, for example, who have more advanced diabetes and need a stronger treatment, because oral drugs are effective when the person doesn't have, for example, a very severe endothelial dysfunction. In the case of someone who has had diabetes for a long time, it's often necessary to use these drugs, injectable drugs in the penis.
And do they inject it themselves into the penis? Do they apply it themselves?
Yes, they learn in the doctor's office and then do it at home afterward.
And are they effective?
They're very effective, but many patients don't adapt because they have to insert a needle into the cavernous tissue. So it can be a bit painful, and it's also something that takes away from the romantic situation, right? Of course, the person has to stop
And inject himself, which is a bit unpleasant, yes. And what new treatments or new drugs are appearing? Anything novel in erectile dysfunction?
There is a new treatment that is well established, which is the use of shock waves for the treatment of erectile dysfunction. So it's a treatment where the person is put in a situation where the shock waves cause microdamage in the erectile tissue. And since the body's response is regeneration, that regeneration improves erectile function.
So microdamage where? In the corpus cavernosum? Yes. And the body regenerates it?
It regenerates it. Just like, for example, when you do strength training, a weightlifting exercise, and there are microdamages in the muscle tissue. Those microdamages are also what happens in the cavernous endothelial tissue. In this way, there is endothelial regeneration and circulation improves.
Interesting. We haven't talked about it, but when there's a disease that lowers testosterone, giving testosterone also improves the dysfunction.
The thing is, testosterone is not a very strong drug to improve erectile dysfunction, but if it's proven that the person has a hormonal dysfunction, it's necessary to replace that testosterone. But if this person also has endothelial damage, this testosterone alone is not going to solve it.
It doesn't help.
It doesn't help much.
And what is called psychogenic or central erectile dysfunction still exists. There were some drugs there that I don't know if they're still being used, which were melanocortin agonists. How is that now?
It's still very much in the early stages. There are two types of agonists. One that is, in fact, it's even approved in the United States for female orgasmic dysfunction.
Also in women.
Yes, but there's another one that's very common on the black market on the internet, and there's not much scientific evidence because it can even cause melanoma.
Of course, it makes sense. Very dangerous. Well, what do you think will be the big revolution in the field of urology in the coming years? The big breakthrough?
The big one, maybe it will be mesenchymal stem cells. I think it will be. They are currently being studied, but they are not so widely available. There are people using stem cells in studies, but they are not clearly available to the public.
He asks Alain a question. If you could eradicate just one habit, eliminate one habit in all men in the world to prevent erectile dysfunction, what would it be?
It would be the habit of not doing physical exercise. The great evil of this century today is people working at computers all day. And there are even studies saying that people who don't do physical exercise and spend all day working at the computer have a much higher risk.
In Brazil, is it very common for people not to go to the gym or not to work out? Because I understand that in Brazil, people take good care of themselves.
Yes, they take care of themselves, but that's only about 20% of the population.
So a few people take great care of themselves while most don't, right? And you work out and apply it.
Yes, I work out, yes.
Of course, that's great. Well, doctor, it's been a pleasure having you here. I don't know if you'd like to send a message to the audience to close the interview, a recommendation, some advice, whatever you want.
My message to the people is that please keep in mind that it's very important that for every hour of work at the computer, you stand up and walk around your room. Because this simple habit is very important for improving cardiovascular health and also overall health.
Excellent. Well, we thank you, doctor, for your kindness, and I hope this talk helps a lot of people, especially many men, to improve their health. So thank you. Thank you. You already know, erectile dysfunction is not just about sexuality, it has to do with many other aspects of health, so don't ignore it. See you in the next episode, a big hug, and keep empowering yourselves.